Hello, my name is Christine, and today we are going to be talking about nursing theorist Florence Nightingale. We will discuss her life, background, nursing theory as it pertains to the four nursing meta-paradigms, as well as how her theory relates to nursing today. Many social changes took place during the life of Florence Nightingale. In 1837, Queen Victoria took to the throne. Vaccines for the poor were introduced, although they were not yet mandated at the time. In 1847 to 1849, cholera epidemic spreads in London, England, and Europe due to infected water and poor sanitation conditions. In 1853, the Crimean War breaks out at a time where nurses are seen as menial and lower class. Over time, with the help of Florence Nightingale, nursing, as well as healthcare, is greatly transformed. Florence Nightingale is considered the first nursing theorist of our time. She thought of nursing as an art and felt that the environment influenced healthcare. She believed nursing and medicine were two separate things. As we continue, we're going to take a deeper look into who Florence Nightingale was and the effects that she had on nursing today. Florence Nightingale was born in Florence, Italy, to a wealthy family on May 12, 1820. She was raised in Derbyshire, England, where she was educated by her father, William Edward Nightingale, and was classically educated and fluent in 7 languages. At a young age, she was known to tend to the ill and poor people in her village next to her family's estate. For Florence, women of her stature were expected to marry a man of means to ensure her class standing. Florence was awkward in social situations. She knew her calling was to be a nurse, but being a nurse was looked down upon for someone of her social class, and her parents forbade it. In 1851, her parents gave in and let her attend nursing school. During the Crimean War, Florence was asked to go tend to the sick and wounded soldiers after news of the deplorable conditions the soldiers were in got out. Patients were found surrounded in filth and were not being fed properly. Florence quickly got to work attending to the soldiers and cleaning the hospital up. With her skills and leadership, she was able to increase the survival rate amongst the sick and injured soldiers. This act made Florence instantly famous upon her arrival back home. While Florence Nightingale did not propose a certain theory to her nursing, her work and findings are centered around the environment. While reading Florence Nightingale's notes on nursing, one can clearly see how important the environment is to one's health. The environment consists of everything around us from our homes, work, hospitals, doctors' offices, and so on. We will get more into how the environment can influence a person's health when we start talking about the nursing meta-paradigms. A meta-paradigm is a structure or framework of how a model is developed. In nursing, the 4 meta-paradigms include person, environment, health, and nursing. We are going to break these 4 categories down into sections and apply them to Florence Nightingale's nursing theory of environment. The person is the individual receiving care, also known as the patient or client. The environment consists of several factors as seen on this slide. It should be well ventilated, while at the same time keeping the patient warm and comfortable. The surrounding area needs to be clear of soiled, dirty, and standing filth. Noise should be kept to a minimal to promote rest and healing of the sick and injured. Proper amount and type of food needs to be offered to the patient to assist with the healing process. As well as the room, the patient needs to be kept clean so that filth and bacteria cannot grow and spread to others. The health of a person consists of several factors including the environment, psychological well-being, diet, and personal hygiene. The environment consists of everything around us and can include a hospital, a doctor's office, or any area around us at the time. This area must be fostering in a way that promotes a healthy environment and cleanliness. A person must also have their psychological needs met, be it in the form of education, expression of fears and concerns, and so forth. Diet is an important part of one's health. Nutrition is not only needed to sustain life, but also provides needed nourishment for healing. Personal hygiene must be kept up to reduce the spread of infection, and it also provides a positive psychological factor. Together, the environment, psychological well-being, diet, and personal hygiene all play an important role in promoting and maintaining health. There is more to being a nurse than giving patients medications. A nurse must see the patient for the whole holistic being that they are and take care of the entire individual. Florence Nightingale's nursing theory of environment also correlates into nursing practice today. Let's take a surgical situation, for example. The room needs to be clean while its instruments are sterile for the procedure. The staff performing the procedure needs to make sure they use clean and sterile techniques with their hygiene as well as with the patients. The combination of clean and sterile environment helps to prevent an infection to the patient getting the procedure. In conclusion, we have learned that Florence Nightingale was the first nursing theorist of our time. Her nursing theory of the environment can be placed within the 4 nursing meta-paradigms to give us an example of how her theory can be related to nursing in the past as well as today. The environment has a strong influence on the health of people both inside and outside of the hospital. A clean environment promotes health as well as helping to prevent the spread of filth and illness. Thank you for watching.